20 years ago, when we had the conference, it was a new concept. The idea of periodontal medicine was fairly novel. And there have just been a series of over 10,000 articles published. And these now have clearly established the relationship between periodontal disease as a modifier of general health. And it can have an important impact in areas of diabetes, heart disease, stroke. And that there's important data now to show that from insurance populations that have been followed that have really clearly demonstrated that when patients have these conditions, having periodontal care reduces the rate of these severe complications associated with these chronic conditions, reduces the morbidity and mortality of those conditions, and it also leads to a reduce in medical costs. So when you're providing care for gum disease, you're not only improving the oral health, which is a very important part of general health, but it also improves the systemic health as well and well-being. I think that we now have had a tremendous impact of the genomic era. The microbiome is better understood. The genetics of periodontal disease has been studied and starting to reveal secrets where we can really identify who is at risk. And we need to move forward with this new information to begin to treat patients with more customized therapy to provide what's called precision care, where we can actually tune the care that we provide to make it more specific for just them.
I think this series, this program, has been very, very useful in terms of advancing information dissemination and the cutting edge of research in periodontal disease and inflammatory diseases such as type 2 diabetes and cardiovascular disease. I think it's all been very useful for the community at large, as well as actually being useful for the academic community, bringing everything into one place, key thought leaders, and et cetera.